Hello there, I'm Chris Halloran. I'm going to present a few of the features of the PANasta trial. The aim of this study was to evaluate whether a Blumgart anastomosis reduces the postoperative pancreatic fistula rate when compared to the more traditional Cattell Warren anastomosis, both employed following a Whipple's type resection for presumed peripancreatic cancer. This is not only the largest trial ever conducted for these two anastomoses, it was also undertaken in 7 high-volume UK pancreatic centres. There are 3 unique features of this trial. Firstly, that preceding the trial, an operative manual was developed to describe all of the key stages of the anastomosis, which help with quality control. Secondly, that randomisation was undertaken intraoperatively to reduce bias. And thirdly, that the quality of the anastomosis and security of the arm of randomisation was undertaken by photographic evidence. The primary endpoint was the fistula rate between the 2 arms, and secondary endpoints were those of entry into adjuvant therapy, hospital stay, mortality and survival. Excuse me. We can see from the data on the right side of this poster that eventually results were received from 236 patients. 124 participants received a Cattell Warren anastomosis, 112 a Blumgart anastomosis. Although the majority of the fistulas were harmless biochemical type A fistulas, type B and C fistulas were also observed. The overall clinical relevant fistula rate was only 11%. We can see down in table 2 that the Cattell Warren anastomosis had a slight increase over that of the Blumgart anastomosis in terms of fistula, but that was not significantly significant. Post-operative stay was also longer in the Cattell Warren arm, but again, not significantly significant and only of 2 days. The most important factor in patients undergoing resection of pancreatic cancer is entry into adjuvant chemotherapy. And it was interesting to see that the Blumgart arm entered chemotherapy around 2.5 months following surgery versus 2.9 months with the Cattell Warren arm. Again, not significant. Overall survival seems to suggest that those undergoing a Cattell Warren anastomosis had a slight advantage, but again, that was not significant, as we can see by these graphs. So in short, the PANasta trial is the largest surgical trial ever conducted comparing these techniques. There was no significant difference in post-operative pancreatic fistula between the 2 arms. In a UK population across 7 of the highest volume centres in the country, the national clinically significant fistula rate is around 11%, and 75% of patients who are eligible to undergo chemotherapy enter that chemotherapy. Thank you very much for your time.